Filipinos are known to be respectful, especially to the elderly, as it is highly regarded values of society to respect older individuals. Even to public areas and facilities, respect for older people can be seen, such as priority lanes for older people, 20% discount for medicine, transportation, and restaurants. However, our population does not only growing but aging as well. In fact, the number of so-called senior citizens or Filipinos aged 60 years and above doubled to 9.2 million in 2020, from 4.5 million in the year of 2000, when they represented the 5.9% of total national population. As the number of older persons increases, so will the prevalence of chronic disease, disability, dependency, and any social dysfunction. Social services to older person was not a priority concern, probably because of the prevailing belief that the culture provides a construct insurance for this matter, that children will look after their parents in their old age. However, values are changing rapidly because of social forces such as urbanization, industrialization, and migration, and children cannot anymore be expected to assume responsibility for their parents' care when they get older. It is becoming common nowadays to see older people begging in the streets. High cases of abandoned, physically or verbally abused old people. The older people, like all other members of society, should be given the opportunity to live decently and productively. Social services such as economic dependency, health and medical assistance, emotional and social help should be available to those who for a certain reason or conditions are unable to look after their own needs, including the older individuals.
Coordinate the care of older patients in a variety of settings, including hospitals, community health clinics, long-term and residential healthcare facilities, hospice settings, and outpatients or daytime healthcare centers. The American Geriatric Society projects that about 30% of Americans ages 65 and over will need geriatric care by 2030. In outpatient settings, geriatric social workers are advocates for the older adults, ensuring they receive the mental, emotional, social, and familial support they need, while also connecting them to resources in the community that may provide additional support. In inpatients and residential care settings, they conduct intake assessments to determine patients' mental, emotional, and social needs. Collaborate with a team of physicians, nurses, psychologists, case managers, and other healthcare staff to develop and regularly update patient treatment plans. Discuss treatment plans options with patients and their families, and their manage patients' discharges. Geriatric social workers support clients and their families through a combination of psychosocial assessment, care coordination, counseling and therapeutic work, crisis management and interventions, and discharge planning.
Roles of geriatric social worker to clients with poor family. Providing advocacy services such as acting as mediators or directly intervening with social services, organizations, or governmental agencies. Poverty is the greatest obstacle to a secure old age. So the role of geriatric social worker is to prioritize the needs of the unprivileged elderly. Programs of social security such as SSS or Social Security System, GSIS or Government Service Insurance System. Also, there are elderly volunteer programs, discounts and privileges for senior citizens that help in providing care and assistance for the elderly. Rules of geriatric social worker to abandon and physically abuse clients is responsible for ensuring that residents are protected from abuse and abandon. Geriatric social workers play a crucial role in providing emotional support and counseling to clients and to their family members, managing difficult conversations among client, family care providers, contacting relevant organizations and or authorities in the case of elder abuse, and developing a short and long-term support plan for clients. Elders in residential care facilities. Geriatric social workers perform a number of functions in elders in residential care facilities, including helping the old adults adjust to life in their new residences, advocating for their clients' needs and rights, providing support, counseling, and making psychosocial assessment. Other rules. Geriatric social workers work with older population in many settings. At any organization that serves physical, mental, emotional, and social needs of senior citizens, they play a crucial role providing direct care, counseling and advising, resource navigation services, and etc., as well as care coordination, contacting different departments, care providers, and organizations to ensure the clients to get the inpatient or outpatient support they require. Common works geriatric social worker employ include medical settings, adult health programs, programs for all-inclusive care for the hospices, nursing home, and residential care facilities.
List of the DSWD programs for senior citizens. Social Pension Program. The social pension is an additional government program that provides indigent senior citizens with a monthly allowance of 500 pesos to help with their basic needs and other medical expenses. Congress reviews the social pension program every 2 years in collaboration with the Department of Social Welfare and Development. Refers to a qualifying senior citizen who is poor and over the age of 65, is frail, sick, or disabled, has no pension, no stable source of income, and receives no regular support from family members to meet basic needs. Healthy and Productive Aging Program. These programs' main goals are to improve elderly people's quality of life and strengthen the country by ensuring that everyone has access to high-quality healthcare for millions of poor and vulnerable people. National Laws for the Elderly. Republic Act 7432 or the Senior Citizen Act of 1991, or an act to maximize the contribution of senior citizens to nation building, grant benefits and special privileges, and for other purposes. This allows elderly persons to receive a 20% discount on the domestic transportation cost, as well as to utilize hotels, lodging facilities, restaurants, theaters, recreation centers, and buy pharmaceuticals and medicines anywhere in the nation. It also established the Office of Senior Citizens Affairs, OSCA, at the city or municipal mayor's office and exempts senior citizens from paying individual income tax. RA 9994 or the Expanded Senior Citizens Act of 2010 is the most recent amendment and prevailing law for senior citizens. It provides for the following benefits and privileges: discount and additional government assistance. Discount: free service, training expenses, and a 20% discount, a 12% value-added tax exemption, discounts on necessary medical supplies, accessories, and equipment, free vaccination against the flu and pneumonia. Additional government aids such as the social pension, the requirement to enroll in PhilHealth, the social safety nets, and death benefit payments. RA 9257, otherwise known as the Expanded Senior Citizen Act of 2003, makes it essential for business to offer a 20% discount on products and services to elderly persons, thereby extending the scope of advantages and privilege available to them. The technique for assembling the OSCA and choosing the OSCA head is also installed. However, what's more significant is that it offers a true structure for elderly citizens to support their ability to age more purposefully and effectively.
This is all the residential care facilities in the Philippines. 1. Bahay Dona Rosario by Rent-Free Care Services and Senior Residences, Assisted Living Facility in Muntinlupa, Metro Manila. 2. Country View Assisted Living Facility Incorporation, Nursing Home in Davao City. 3. Life Care Residences Philippines Home Health Care Service in Cebu City. 4. St. Jude Care Facility, Nursing Home in Pasig, Metro Manila. 5. Laverna Aged Care and Dementia Village Nursing Home in Marikina, Metro Manila. 6. Residential Assisted Living Facility in Manila. 7. All Care Assisted Living Philippines Incorporation, Assisted Living Facility in Tagaytay, Cavite. 8. Victoria Crest Nursing Care Facility Services, Nursing Home in Davao City, Davao del Sur. 9. Tagaytay Residential Lot Condotel Splendido Taal Tagaytay, Assisted Living Facility in Mandaluyong, Metro Manila. 10. Camillus Midheaven Nursing Home in Marikina, Metro Manila. 11. Blessed Family Home Care Facility, Home Health Care Service in Quezon City, Metro Manila. 12. De Gracia Compound Assisted Living Facility in Cagayan de Oro, Misamis Oriental. 13. Mabuhay Nursing Home in Iloilo City, Iloilo. 14. Healthcare 1 of Silang Nursing Home in Silang, Cavite. 15. Life Care Living Solutions Incorporation, Assisted Living Facility in Morong, Rizal. 16. Gasaid Planas Elderly Care Home, Aged Care, Porac, Pampanga. 17. Managing Elderly Care Training Center in Makati. 18. Big Hearts Adult Daycare and Assisted Living Adult Daycare Center in Parañaque, Metro Manila. 19. Bless Home Adult Daycare Assisted Living Adult Daycare Center in Parañaque, Metro Manila. 20. Heart of Mary Villa Non-Profit Organization in Quezon City, Metro Manila. 21. Heaven for the Elderly Retirement Home in Tanay, Rizal. 22. Angels Care Home for the Elderly Nursing Home in Dasmariñas, Cavite. 23. Home Health Care Services in Quezon City, Metro Manila. 24. Care Philippines Non-Profit Organization in Quezon City, Metro Manila. 25. Anawim Home for the Abandoned Elderly Mission in Rodriguez, Rizal. 26. The Children's Joy Foundation Incorporation Association or Organization in Davao City, Davao del Sur. 27. Bridges of Hope Rehabilitation Center in Quezon City, Metro Manila. 28. Healthcare Facilities and Services Regulatory Bureau in Metro Manila. 29. Sonata Private Residences Condominium Complex in Mandaluyong, Metro Manila. 30. Kamanggagawa Foundation Incorporation Novaliches, non-profit organization in Quezon City, Metro Manila. 31. DMCI Homes Corporate Center Real Estate Developer in Makati. 32. Kanlungan ni Maria Hospital in Antipolo City. 33. Maricelo Villas by DMCI Homes Condominium Complex in Las Piñas, Metro Manila. 34. MedRise Condominium DMCI Homes Maricelo Villas Condominium Complex in Las Piñas, Metro Manila. 35. National Vocational Rehabilitation Center NVRC Rehabilitation Center in Quezon City, Metro Manila. 36. Lourdes Agape Recovery Center Incorporation Rehabilitation in Amadeo, Cavite. 37. CARE Change and Recovery Rehabilitation and Treatment Center Rehabilitation Center in Tagaytay, Cavite. 38. Anawim Lay Missions Foundation Incorporated Business Center in Rodriguez, Cavite. Rizal, 39. Heart of Jesus Treatment and Rehabilitation Center in Mendez, Cavite. 40. Happy Homes Housing Cooperative Cooperate Office in Tanza, Cavite. 41. The MCI Homes Incorporation Real Estate Agent in Makati, Metro Manila. 42. Hamizola Residence Housing Complex in Quezon City.